Global Allergy and Airways Patient Platform believes we can all live better. Today we're going to talk about asthma. Are you living with wheezing, coughing, and difficulty breathing? In just a few minutes, we'll help you learn what you need to know about asthma. We'll look at an overview of asthma, symptoms of asthma, and learn how to live better with asthma. Asthma is a chronic lung condition that affects your airways or bronchial tubes. It causes your airways to narrow, swell, and produce extra mucus, which in turn makes it more difficult to breathe. The narrowing of the airways causes you to feel short of breath, wheezy, or trigger fits of coughing. Asthma can affect people of all ages, and while it might be mild for some, it can be more severe for others. For those severely affected, it can have a major impact on normal everyday activities or cause life-threatening asthma attacks. Asthma is a long-term chronic condition, but when an asthma attack happens, it can be serious. There are some early warning signs that you can look out for that may suggest an asthma attack is likely. The symptoms are usually mild, but can be useful to recognize so that you can do your best to prevent a full-blown asthma attack. The early warning signs and symptoms to look out for include shortness of breath, extreme tiredness when exercising, wheezing and coughing after exercising, having a frequent cough, especially if it's worse at night, a decrease in your usual lung function, which can be measured by using a peak flow meter, allergies or a cold, including nasal congestion, sneezing, sore throat, and a headache. The airways to the lungs are normally open, allowing air to move freely in and out of the lungs. However, people who have asthma have sensitive airways that are irritated and inflamed. Asthma symptoms are caused when the airways tighten or constrict in response to triggers, resulting in less space in the airways to breathe through. The symptoms can be triggered by various irritants, substances, and circumstances. The known triggers include exposure to smoke, pollen, or fumes, respiratory infections such as cold or the flu, allergic reactions such as dust mites, animal fur, feathers, or pollen, changes in weather including cold air, thunderstorms, heat, humidity, or any sudden change in temperature, taking medicines such as anti-inflammatory painkillers, sulfites and preservatives added to some foods and beverages, including dried fruit, shrimp, processed potatoes, beer, and wine, experiencing strong emotions such as stress, being exposed to damp or mold, physical activity, especially if doing so in cold and dry weather, and gastroesophageal reflux disease, or GERD, where stomach acid comes back up into your throat. If your doctor suspects you could have asthma, they'll ask about your symptoms and undertake tests to diagnose it. They'll look at your nose, throat, and upper airways, listening to your breathing using a stethoscope and taking a general medical history. Lung function tests will be carried out to see how well your lungs work. Common tests used include spirometry. This is where you blow into a machine that measures how fast you breathe out and how much air you can hold in your lungs. A peak flow test. This is where you blow into a small handheld device and it measures how quickly you can breathe out. Or a pheno test, where you breathe into a machine that measures the level of nitric oxide in your breath, and this can highlight lung inflammation. Asthma treatment and medications help to control symptoms so you can live an active and normal life. As everyone experiences asthma differently, your doctor will put together an asthma treatment plan designed specifically for you. The two types of inhalers that are used to relieve and prevent asthma are reliever inhalers. This is used to treat your symptoms when they occur and usually works within minutes. A preventer inhaler contains a steroid medicine and is used daily as prescribed to reduce the amount of inflammation and sensitivity in your airways. And recently, a single inhaler offering both reliever and preventer medications is also available. Depending on your symptoms, tablets or other treatments may also be prescribed. Complementary therapies, such as special breathing exercises, may be recommended to help you learn to breathe better with asthma and increase your overall lung capacity, strength, and health. If you think you have asthma, please see your doctor. If you have asthma, be sure your asthma is in control. GAP believes in empowering patients around the world and wants you to live better. For more information, go to gap.org. The mission of Global Allergy and Airways Patient Platform is to globally support and empower patients with allergies, airways, and atopic diseases by protecting their rights and insisting on the duties of governments, healthcare professionals, and the general public. Thank you for listening. Join us for more GAP Notes health presentations.